Ah, welcome to my apartment. How you doing? Dr. Rodriguez is here.
Nice
Now
to
let
meet
me
you.
let me ask you about
Dave, can you introduce me? Hi, everyone. Bianca Torres.
So
I'm
let me
back,
tell you something.
apartment
This is my
5G.
neighbor, right? And she's always popping in my crib and like borrowing stuff or being like very nosy and things like that. So like a lot of times I tolerate her, but she has red on, so she's kind of good. Like today's red day, I guess.
Anyway, I saw you pull up. You looked interesting, so I decided to sit in today.
Looking forward.
I want to know about the different doctor titles. The reason why I asked that, I never, and this is wrong of me, I didn't ask my child's mother what kind of doctor she is. She got her doctorate. And she was like, yo, I'm a doctor now. And, you know, sometimes people be having doctor in front of their name. And normally we always, think of doctors as health doctors, meaning physical health.
Right.
So what are the different doctrines that's out?
In mental health?
Period first. Let's try that.
Okay. So there are medical doctors that are an array of specialties, right? So whenever you go to the doctor, if you need orthopedic, whatever, something like that, there are those kind of specialty doctors. But specifically in mental health, I think people get confused a little bit between psychiatry and psychology. So I'm a psychologist. So
now you are a psychologist doctor.
Right, because I got my doctorates in psychology.
In psychology, okay.
Right.
So when someone gets their doctorate, that's just that means you just a master at whatever.
Right.
Okay.
Yeah, that's like the highest
So
level of
probably
education.
my child's mother got a doctorate of being a headache.
I plead the fifth.
I just said that could be it, right? That wasn't funny?
No, it wasn't. I see what you were trying to do, though.
No, I'm just saying.
You almost had it.
Okay. You smiled though. Got her laughing. Hello, you too. All right. So you have a doctorate in psychology.
Correct.
What exactly is that?
So that means that I went to training to learn how to provide different types of modalities in terms of therapy. So there's different types of therapy that you can provide. And you can also be trained with different populations. So I was trained with children and adults.
So you're the person that, like, let's say for instance, I'd be like, dang, I messed up, and I go lay on the couch and I talk to you?
Yeah, that's like traditionally what happens. That's what people think of therapy.
Do psychologists need a psychiatrist?
Only if you want to prescribe medications. So psychologists do not prescribe medications, but psychiatrists can.
Meaning you?
Meaning me. I do not prescribe.
No, when I say that, meaning, is there ever a time where you or a psychologist need a psychologist?
A psychiatrist?
A psychiatrist?
Yes, if we think that our patient would benefit from medication.
I was going over your head again. I'm saying you.
Do
period.
I?
Yeah, because we all have, you human, right? So we all have issues also. So is there ever a time?
Oh, like do psychologists as professionals need psychiatrists? Of course.
Okay.
We need other psychologists and we need psychiatrists.
So how does that work? Because you're supposed to be the person that has the answers, but then you go to somebody else with it. I'm confused.
Because you don't go to therapy for answers. You go to therapy to process and explore.
Okay. Hello. Right?
Yeah.
So now you specialize in mental health.
Yes.
Okay. And so exactly what is that? Because I know a lot of times in the new era, mental health is like sort of big. And I remember years back, it's like, they just called you crazy and left you alone. Now it's like, no, they're more sensitive to that subject.
Yeah.
So can you explain that or maybe even the difference from before to now?
So I think that mental health or mental health difficulties is on a spectrum, right? So yeah, there's definitely still people who are psychotic, right? And they're maybe disorganized in the community. And they do benefit from more intensive services. But then there's people, just everyday folks, who maybe have a bout of depression or they're anxious and they just want to talk to somebody about that. You don't necessarily need a diagnosis to go to see a psychologist. You can go because you're just having a difficult time and you want to talk to somebody about it.
Do you feel that social media is a form of like being a psychiatrist? Because you're saying people talk to people. A lot of times the first thing people do is sit and they talk to their phones or whatever like that.
It can be therapeutic to express yourself that way or to see other people going through something similar to you. It can definitely be therapeutic, but it's not in replace of therapy.
There's no one. We got to make sure to be clear, right? You got to keep
clear.
the money coming in.
Just be clear.
No, but even still, because social media could be a source of why you need therapy too. Like, you know, especially with like body image, bullying. So it's like it could be go either way.
And there could be misinformation out there. Like nobody's fact checking media, social media. So you don't know.
So how do so is it like embarrassing that somebody come to you and be like, yo, I need like a session or something like that? Or is it like people be nervous?
Some people are nervous, yeah, definitely. Some people are not sure what therapy is going to be like. You know, what does it mean to have a therapist? Of course they're nervous, and sometimes they don't know what to talk about or if they should bring certain things up.
So what's like your strategy in getting the stuff out of them?
So my strategy is definitely building that relationship from the beginning, and also providing like a sense of this is what therapy could look like. It's different for everyone, but this is kind of where I'm coming from with it. And I also give people a chance to say like, well, that's not for me. I need a different kind of style of therapist.
Okay.
Right? Because everybody has their own style. And it's really about the connection you make with your therapist. That's how you make the most out of therapy.
There's a certain population that you focus on, right? Because there's like certain doctors deal with women or children. What's the population that you deal with?
So I wear various hats. So like my full-time job, I work in a hospital. So I work with really severe and persistent people who have mental illness and mental health struggles. But then I also see folks in like a private practice setting where it's more of like your everyday person who may want to come and see somebody to talk about their everyday struggles. I definitely tend to attract folks of color because I think they're looking for a person of color to be their therapist. So that's like the bulk of the folks that I work with. And in the public hospital, that's also mostly what I work with.
When you say severe, what does severe entail?
So severe and persistent mental illness are folks who have more intense symptoms. So maybe when they're psychotic, they're like talking to themselves, they're not in touch with reality. Maybe they don't take care of themselves, like don't bathe, are not organized enough to keep their own apartment, to have a job, right? So it's really impacting their functioning on a daily basis.
So is that something that that you grow into, or is that something that you're born with? Like, because sometimes I do see people walking out talking to themselves, but in actuality, I think we all talk to ourselves. Like we have a voice in our head that we talk to ourselves. So,
definitely.
Right? I'm pretty sure you talk to yourself.
I mean, I do very often, but I think it's a place and a time, and I guess how you do it, right? Like, I mean, I do it in public.
Well, what makes it different is like you talking, you talking to yourself. But so is that hereditary, or is that something that like happens?
So there can be a hereditary component, but it doesn't mean that if one of your parents has, like, for example, schizophrenia, that you're definitely going to have schizophrenia, right? It's kind of like a genetic, like 50%, 50%. So there is a genetic component, but I think a lot of other things also play into it, right? I think like homelessness, other psychosocial stressors can kind of cause a psychotic episode if you're not, taking care of yourself. And also sometimes substances can cause psychosis.
Like drugs.
What about trauma?
Trauma can also cause, but it's not psychosis like talking to yourself. I think it can more just be displayed as like what psychology would call paranoia, but it's really not paranoia. It's just like a hypervigilance because of the things that you have been through, right? So you're kind of like hyper aware when you're in the community. You're always like kind of looking behind your shoulder, and that kind of just like raises like your overall, like you maybe be a little bit more tense, your heart is racing sometimes. And so it's not necessarily paranoia, it's just like a hyper awareness of your environment, which I think a lot of people from where we come from have that.
Too.
Yeah.
Because, I went to go see this girl in the projects one time, right? And it was mad dudes in the lobby.
Yeah.
And you know what I'm saying? I'm like, I can't do that no more. So I might have that. What you mean, duh? Like, that's traumatizing. You know what I'm saying? Ray Rand was in the lobby.
On a more serious note.
No, that's the truth. So
on a more serious note, in the hip hop culture, I feel like rappers suffer from that, right? Like they come from environments where unfortunately, there's killings, drug dealings, whatever the case may be. Some of them have to do things to survive. So they become desensitized. And I feel like the public sometimes, they don't really realize, because even though they're desensitized, they still need help. Yeah. Like you see a lot of rappers now talking about getting help from mental illness and therapy and stuff like that. So,
yeah. I mean, anyone can benefit from at least having an understanding of what's going on, right? Like if you have an understanding when you're walking into that building, like, I know what this is, I'm having a reaction, instead of like, why am I bugging right now? Like, I shouldn't feel this way, right? So it's just about understanding yourself. And if you want to make those changes, right? If you don't want to feel like on edge all the time, like, what are the things that I can do to help myself?
Is it hard for you to, like, process a diagnosis? Because I think that a lot of times in life we all just grew up differently, and we all have different experiences. So
Definitely.
maybe your experience of something, you could be I guess I would use the word ignorant to someone else's experience. So how do you manifest through that?
Well, I think that a big part of it is building that relationship with your client. So before I'm thinking of diagnoses and things like that, I'm thinking about who you are as a person, right? So that I can make sense of, is this cultural? Is this from where you grew up? Is this like normal for your family, right? Because then maybe that's not a bona fide diagnosis. It's just like how you have been living, right? And maybe you want help with that, maybe you don't, but it's really about getting to know the person, where they come from, culturally, neighborhood-wise, you know, and all the ways, so that way you can kind of get an understanding of what you're seeing in front of you.
You're from the Bronx, so do you feel that...
What part of the Bronx?
What part of the Bronx am I? Well, right now I live
That means
in...
you're about to lie to me. See, I'm a psychologist too.
Yeah.
When somebody repeat the question, that means they're about to lie.
Well,
you understand what I'm saying?
I was thinking twice.
There you go.
Because I'm
Because
wondering if you're asking...
Because
why.
she's moving a certain way. She's on
Nah,
camera.
she's
She's
about
not
to
going to put
lie.
everything
That's
on
why
Front
you see.
Street.
I should this was Dr. Self. That's what they call me.
Dr.
She's about to
Self,
lie.
DJ
Here we
Self.
go.
Absolutely
yeah.
not.
You're about to lie right there. Here we
She's
go.
from the Bronx, dude.
I didn't say that. I believe that, but you're about to lie about what part of the Bronx you from.
Well,
when somebody say, what part of, does you,
Maybe
you
she don't
giving
want you to
your
know
time-
all her information. She
No,
don't
you about
want
to
you
give
like
yourself
that.
time to think. What lie I'ma say? Go ahead. Right. I
Well,
gave you
Can you
like
let
some
her
space.
answer the question?
Well, I guess I was thinking about like where I grew up or where I'm at now, or when you
Well,
say
where you
what
grew
part
up.
of the Bronx I'm from. Parkchester.
Oh, okay. By Steppins.
By Steppins.
Oh,
yeah,
you think
yeah.
I know about that? Hello. You know what I'm saying?
Back to the conversation. So, do you feel that because you come from the Bronx and you do appeal to the Black and Latino community, do you feel that obviously helps you when it comes to like treating them, because you can relate, right? There's a sense of being able to relate and understand, because that is on its own a different culture. So does that benefit you with your patients?
I think it definitely does benefit. Like, I think that there is a connection there when you're telling someone a story and you say a particular word and you're like, you know what I'm saying, you know what I mean, right? And so they kind of think that I do know what they mean because I'm from where they come from, right? So they know when they talk about certain places, like, oh yeah, I know, I've been to that place, and how was it for you when you went there and stuff. So we're able to kind of connect on that level.
And I'm sorry.
Good.
And you do something called community therapy, right? Or I'm chopping it up. You take the community approach. Can you talk a little bit about that?
Yeah, so I am like coming into myself as a professional. I'm really starting to view myself as a community psychologist, right? So what that means is that how you kind of were asking me, right? Like, how do you know if it's a product of where this person comes from or they're having an actual symptom, right? So that's why I think it's important that I do want to know about people's community, where they come from, their neighborhoods, right? And also think about how that plays into maybe symptoms or treatment. How would it be different, someone coming from this area, right, who maybe may not have access, or they may have to use different interventions versus someone coming from a different neighborhood or a different community?
Yeah, I'm from like a different neighborhood. That's why, and I think that a lot of people think I'm like from the hood, and I'm not from the hood. I'm from a nice neighborhood in Brooklyn, New York.
Okay.
So I think that I come across as like.
Why do you think that?
I don't know. You know, I don't know. Maybe I was like the kid looking out the window and wanting to be in the streets. You think that's that?
You were absolutely the kid looking out the window through the screen. Yeah, absolutely.
I'm fine with that though. I'm cool with that.
Okay. As long as you're cool with it.
So how important?
Do you know about narcissistic behavior?
You think I'm a narcissist?
A little bit, yeah.
Well, I don't think so.
Okay. That's another topic. We'll invite you back and we'll dissect what makes a narcissist.
So, like during sessions, do people talk, or you talk, or you just sit and listen?
I think it depends on what the person needs.
Okay.
So sometimes there are clients who really, I just need to let this out. I need to vent. And there's some clients who are like, so what do you think? After they tell me a story, right? And it kind of goes into like the back and forth. Sometimes, yeah. Or I can point out like, you're kind of doing the same thing you said you wasn't going to do. You're getting with the same kind of guy, or, so what do you think that's about? Just how I asked you, like, so what do you think that's about?
So most of the stuff be like relationship stuff.
Sometimes.
Because a lot of girls, you probably had somebody come in and was talking about me and you just didn't even know it.
Maybe.
I know.
Maybe.
I need to go because I be having like relationships, like, I need to go book a session with you. Because girls are like.
You your own issue, okay?
My
But you should
conversation
actually, he's also a hoarder. That That comes from trauma too, right?
It can.
Does hoarding come from? It does. I don't think I'm a hoarder. I think that you know what it is. Like I collect a lot of things.
I can see that.
And as being a DJ, most good DJs are collectors because we are trained to collect music and to intake music and intake information. So when I say that, meaning as a good DJ, I want to use that word again.
Okay.
Right. Because you know I be a person that collect kind of like mental data of a person and say, okay, this person either likes this type of music or looks like they like this type of music, different things like that. And then my job as a good DJ is to retrieve those things or collect those things. So I think all good DJs are collectors.
Okay.
If you ever go to a DJ's house, a good DJ, they always got figurines or they always have some sneakers, something.
Okay.
They have some type of collection, something. Some even collect candles. I've seen that once or twice.
It's a connection to a culture as well, right? Like if you're collecting certain things, right? See a lot of toys and things like that. It's connected to a particular culture.
Well, when I grew up, my mother never bought like toys like that for me. So now I'm wealthy enough to buy my own.
Okay.
So now I buy that.
That's a healing process for you.
I'm healing myself, right?
Yeah.
Wow.
Yeah, I need to heal from stop spending too.
Maybe.
How could you stop me from doing that? What would you say?
I can't stop anyone from doing anything.
Oh, okay. Well, how would you ease the pain of spending?
Well, I mean, I think I would want to know more about like what does the spending mean to you?
You listen. I saw a Mace video, and he was in Vegas throwing money, and I wanted to throw money too.
Yeah.
And I saw P Diddy pop a bottle of champagne, and I said, "That's the life I want."
Okay.
I'm playing.
If it makes you happy.
I thought we were getting somewhere. I was like, yeah, okay. I will never talk about your figurines again. I thought we were getting somewhere. But
No, that is true
insight.
though. When I was younger, right? When I was
I
true, right?
Yeah.
So I will say this: like my mother was. I grew up very upper middle class,
Okay.
and me saying that my mother was the type of she wouldn't buy me Jordans, but I lived in a nice house.
Okay.
I never was hungry. Never. I'm not the Frank and what would you like Frank and spaghetti or pork and bean eating.
Okay.
I didn't do that, and
Okay.
I'm not saying there's nothing wrong, but I didn't have the expensive clothes. So when I got a chance to create my own income, I like to buy the expensive things that I didn't have as a child.
Okay.
So I don't know if that's hoarding.
No, I think that's valid.
Well,
I
she
think
said
so.
that was hoarding.
No,
That's what she said.
hoarding. I mean, every time I come by, it's like another action figure. But I get it. You are a good DJ. I'll give you that. I don't give you credit for a lot of things.
So is
but
that
I'll give you
hoarding?
credit.
Like when you buy things, that's hoarding? I thought that's like shopping.
No, it's not hoarding. Now, if you had to get rid of stuff, would it
That's
be
that?
difficult?
No, I do get rid of things.
Okay.
Hoarding.
That's the important piece, that you're able to,
I do.
kind of dispose of things when necessary.
I'm single too, so I got rid of the women.
Okay. Were you hoarding women as well?
Sometimes.
Okay. I can see you're a collector of things.
She got you. She got you, boy.
Oh,
That was a good one.
Sometimes. So now, listening to music, do you see, or do you hear, or actually, do you feel that writing music is helps mental illness?
I think it can. Yes, absolutely.
How?
It is a way to express yourself. Sometimes it's a way to organize, right? If you're kind of like your thoughts are all over the place, to have to like put them down on paper or put them in your phone or, have, rap about them, you have to organize them in some way.
Well, I'm not talking about just rap. Maybe just singing
Anyone.
and stuff like that.
Yeah, definitely. Being able to organize your thoughts and put them on paper, that can be really powerful.
Well, you do something online called Learning Through Lyrics, right?
Yeah.
Can you tell us about that?
So,
You a rapper?
No, I'm not a rapper. But I
You
definitely...
reggaeton?
No. Like a reggaeton artist?
Or do you?
No, I'm a psychologist.
Oh, no, but you could be doing it on the side. Like,
No.
Okay.
No. So learning through lyrics is just a hashtag that I use when I hear a particular lyric in a song that I think, okay, this is like relatable to the, therapy world. Then I'll put it out there and kind of give a little bit of what I think, how it's related, and just put it out there so that people could be like, oh, okay,
That's interesting because I feel like a lot of the times, especially when it comes to hip hop, when lyrics are dissected, it's like a negative connotation, right? It's usually like for law enforcement or just for people to talk shit about rappers, right? But I think that you're flipping the narrative and you're making it into a positive.
Yeah.
So I love that.
Yeah, and I think a lot of people use music, as a way to kind of feel connected to others. Like, oh, other people are going through what I'm going through, or someone can like kind of express something in a 2 to 3 minute song that someone's been holding inside, and that can be really powerful for people as well.
I should start making painful. They call it painful music.
Is that what they call it?
It doesn't have to be painful. I could be positive as well, right? Like something that makes you feel good. I think a lot of hip hop is also bigging yourself up. And we talk about like positive self-talk with clients, right? Like you have to be your cheerleader. You have to big yourself up. And I think a lot of hip hop is like that, right? When they talk about how good they are and things like that. So it's a good example of like, that's how you can do it.
Or how many women they got.
It can be, if that makes you feel good.
I got you blushing. I got her.
She's not blushing. She looks like she wants to throw up.
No, she doesn't. I got her blushing. Look, she's taking a sip. You got to learn. I'm a psychologist over here. You understand? When somebody that you don't listen, I'm gonna tell you the rules of psychology. Is body language. Body language never lies. True or false?
It's true.
Come on, see?
Nonverbal cues.
Okay.
No, verbal, you can say whatever. Body language is the key. So she leaned back, went over, took the sip, then she did like this. You know what I'm saying? So that's like when you're a little nervousness and stuff like that.
Why are you even shouting people out?
Because I'm trying to show you and show her that I could be a psychologist.
Nobody cares.
But I am nervous. This is out of my...
Yo, how do you sign up? I want to be a psychologist. I want people to start talking to me.
Okay.
You're the one that caused people problems, please.
Yeah, but so if I'm the problem causer, then I know how to solve the problem. Didn't even think about that.
Okay.
You think we would be married, right?
No.
Oh, okay.
Thank you. Please don't make me throw up on you. Thank you. You wish.
So, as a child, what made you say this is what I want to do? Because most people want to do things that's I guess to some would be a funner profession. I don't know if that would be a fun profession, listening to people's problems.
I don't know if it was since I was a child, but definitely went to college. I majored in psychology. I just kind of wanted to get an understanding of like why people do the things they do. Like
what
how
college
do
you
people...
went to?
I went to New York University.
Okay, NYU. Okay.
Yep.
I've never been to NYU. I've been around there.
Yeah, it's a pretty cool neighborhood.
I've been to many colleges, but never in the classroom.
Okay.
It's crazy, right?
Do you have feelings about that?
Why.
I do. I don't have a high school diploma neither.
Okay.
I got a good enough degree.
GED.
GED.
Nothing wrong with that.
Nothing wrong with that either.
I didn't say there was nothing wrong with that, but I'm just saying, like, I do think that I should go get a high school diploma. What you think?
Do you think you need it?
I don't know if I need it.
But you already have a GED. Why don't you just get a college degree?
Yeah.
I don't want to go to college. You think college is important?
Not for everyone. Depends on what you want to do.
I think with college sometimes you meet people, and I think that the meeting or the socialism of other people, I think that's more important than probably what you learn, in my opinion.
The networking.
The networking.
Can be.
Because I haven't been in a college classroom to be a professional at my opinion on it. So it's just from the outside looking in. But with college, it's like, you know, you could learn a lot of things, but the best teaching is experience. To me.
Yeah.
Would you agree?
I think so.
So even with mental, like you, being a psychologist,
Right.
I think is experience. So again, you know, someone's talking to you about things. If you don't have the experience, you probably couldn't dissect what they're thinking.
It would be harder, or you would be using like strictly what you know from the books. And sometimes that's not always right.
Oh, so the books tell you.
Well, we have a whole book that tells us what symptoms you need to have for any particular diagnosis.
Well, you have to find, I assume there's certain clinical steps that you have to take.
Definitely.
But life experience, and I feel like a lot of people don't talk about this. It's like you can go to school, get a college degree, but life experience matters too.
Definitely.
And you know what I mean? And for me, I mean, even with me and my craft, like my life experiences have helped me tremendously throughout my journey in my career. So when it comes to you, I assume that representation is important to you too. So talk a little bit about that, because I feel like we don't have a lot of like Latina doctors.
Yeah.
So I think it's really refreshing to finally, you know.
Thank you.
So talk a little bit about representation in your field.
I think it's super important. Like you said, there aren't many, you know, psychologists of color who are out there doing the work. The ones that are out there, super dope. But it is important, right? Because sometimes you do need someone that you feel like is representative of you to kind of talk to. The only reason why I really decided to go ahead and get my doctorate was because of another Latina psychologist that told me you should go and do it. So if I never met her, I would have never done it, because I didn't think about doctoral school for myself, you know? I was like,
Oh, so this wasn't something that you thought of growing up?
well, I didn't think that I could make it to the doctoral level, because, you know, that wasn't in my context. Like, no one I knew ever did that, so I didn't know about it. But then I met a lot. I was actually in school to be a teacher, and I was doing my student teaching in Harlem, and there was a Latina psychologist at that school who told me, girl, you should just go do it.
You should just do this.
And I was like,
And you just listen to people talk.
Well,
and get
she
paid.
was like, you're working with all the kids who have emotional problems, not any academic problems.
It's more money. Hello. That's what she said, right?
No. She was like, we need other Latinas.
Okay,
Come
gotcha.
and join us.
Okay.
And I was like, doctoral school seems really hard. Like, I don't know anything about it. And she was like, definitely, it's doable. You can do it. Just go and give it a try. And so I did.
And that's why representation is so important, because it
So
lets you
super important.
know that it's possible.
Yeah.
Because when you don't see someone that looks like you or comes from your background, you know, you don't know if something is possible, then you can achieve that.
Super important.
I got. Well, maybe you could talk to some people and inspire the young. It's just kind of like what they call it. I don't know the word they use, but like the young Hernandezes, the young Rodriguezes, and Pedros and Marias.
Yeah.
What?
What about it?
Can you inspire them to become psychologists?
I mean, not everyone, you know, there are like other names. Not Maria, the typical Maria.
You know a Maria in your family. Keep it real. You got a Maria in your family. Or you know a Maria, a primo, prima. You do, yes you do. Keep it real. I got a Raheem.
I actually don't have a Maria in my family.
I got a Raheem and a Jenkins. I know a Jenkins. We got to keep it real. And a Robinson.
We don't have Marias in our family. Try again.
Your primas or something, or next door neighbor. Yeah, you do.
We have a Carmencita.
Oh, okay, all right.
Yeah.
But how could you talk to them and to you know, maybe they may want to, you know, go down the path because you may want more Latinas.
Yeah.
You know.
I think the most important thing is so that they can find out what it really is like to go get your doctorates, right? That's one thing that I didn't know. And I think a lot of what stops people is the fear of the unknown. What is it going to be like when I have to go there?
Well, that's more schooling,
yes,
correct?
A lot more schooling. You have to write like a dissertation. So it seems like a lot of work. And so just kind of knowing the process, knowing someone who can explain to you, this is how you do it, this is a better way to do it, this is what I learned when I did it. And it doesn't have to be psychology. You can go to doctoral school for a lot of different things, or even just like graduate school. Whatever you need to get to your level of your career, like go for it.
I gotta ask my child's mother what she got a doctorate for, because she did do schooling a lot of time.
And you have no idea.
No, that's so bad, right?
Yeah, it is.
That's real bad.
No, you can make him feel bad. Yeah, that's terrible.
I know. I'm a bad baby daddy. I gotta step my game up.
Well, all you have to do is ask.
You're right.
And retain the information.
What was this for? What was this?
I feel like we
It was a nonverbal, you know,
Yeah,
like you were saying.
actually, you learned it. Hello. Yeah, you is. Hello. Yeah, what's wrong with you? I need you to do like a therapy on her. She needs therapy. There's something wrong with her sometimes.
What
I don't
do
know.
you
And the
mean?
Latina, you know what I'm saying? Like,
I'm amazing.
I didn't see. What's that? Ain't that narcissism or whatever they call
No,
that?
I could feel confident, say I'm amazing.
Big yourself up. You did say that,
Narcissism
right?
is Exactly. Narcissism is when you think the world revolves around you and no one does anything wrong and you don't take accountability or ever apologize. Or if something goes wrong in your life, it's because of someone else, not because you did something.
So now, again, for me having my hood doctrine of psychology,
yes,
right? You know there's something wrong with her, and I'm gonna tell you when someone needs therapy,
okay,
especially a woman, when they talk and they move and do that. And
all
stuff
women
like
do
that.
that. What are you talking about?
Is that a trigger for you?
No, that's not a trigger for me.
Just
but I'm just
because
saying.
you have a reaction.
No, because I know that means there's something mentally wrong with them. When a woman talks to you with their hands and start, especially when their head goes sideways.
Okay.
When the head goes sideways, there's something wrong with them. That means that they trying to they brain is like lopsided, so they trying to put their brain forward. Because you saw her do that, right?
That is quite the interpretation.
I'm just telling you, so I just taught you something.
Forward.
The hood.
So when you talk to people,
you talk to people like this. Baby.
No, that was a terrible analyzation.
It's something because you see how you talking. You like now you comfortable regular, and this one right here.
You always got something
crazy.
Can you say something positive about me for once?
You have a nice red dress.
I guess
that was good.
That's a start.
What about her personality? Because that's like an object that she's wearing. But what about her? She said something nice about me.
Well, me talking about her dress, that means that she had to put it on. So that means her mindset, right, was I put on this dress because it looks nice to me.
Okay.
Oh.
So, okay.
I got
you like her fashion choice? So he said he likes your fashion choice.
I could be a psychologist. I could be a psychologist.
Please don't.
So let me. How do I go about being a psych? Like right now, I want to be because I feel like I got the brains and the know how to do it. How do you start?
So you would have to get your undergrad degree, go to college.
Go to college
first.
Okay, and that's like 2 years.
4 years.
I got to spend 4 years in college.
And then you have to apply to doctoral school.
And they got to accept me.
And they got to accept you.
But I can't cheat like the Westons or Empower or something like that and just get blooded in?
You have to write an essay, do all the application. Now, if you know somebody who knows somebody, hey, I don't know about that. Okay. I didn't get in like that. So
you did it the right way.
I did it. I tried to go the traditional way, wrote the essay.
The long way.
Use my experience to talk about why I think I would be a good psychologist. Okay. And then you have to go to doctoral school, which is 4 years of
and all that costs money.
All of that costs money.
So did you have the money, or they could get a loan or something like that?
Yeah, you
right?
can take out student loans.
And then you still be paying it your whole life.
Yep. Basically.
Interesting. So what steps or what are some approaches that the community can do? Because this is all about community. So what approaches or steps can the community make in order to spread the word about seeking therapy and taking care of your mental health?
I mean, I think it's just about being supportive, right? If someone's coming to you and saying I'm struggling and, I think I need to talk to somebody, it's just about being supportive and maybe providing the New York City Well, right? You can just go online and look up New York City Well and they can direct you on how to seek out a provider. I think that's the really important piece, because I think there has been a lot of stigma in the past about someone who goes to a therapist is quote unquote crazy or anything like that. But I think it's becoming more acceptable. So I think the most important thing is to be supportive of, the people that and, making it just more acceptable. This is part of it, right? This is helping the community say okay, there's people out there like me or who look like me who can provide help.
Absolutely. And where do you think the stigma comes from?
I mean, I think the stigma comes from misinformation, right? I think it comes from what people see, just in TV, movies, what quote unquote somebody who's crazy would look like. And that's what the image people have in their brains. But it's so much more than that. Getting mental health, help or struggling with your mental health is much more complicated. Huh?
That costs though, right?
Getting services?
Yes.
It depends on where you get services from. Also insurance. If you have medical insurance, you can go through your insurance provider. But yes,
but the insurance probably is not going to help you get a real good person, though, right?
I take insurance.
Oh, okay. I don't. That's asking.
Don't assume.
It all spins, right? It don't make it.
But there are private pay, right? And they're community mental health centers that you can go and get a therapist through.
So are those any good, community health centers?
I mean, the thing about community health centers. So let's keep it real, right? Like if you do come
We keep
from,
it veal here.
yeah,
Brian.
okay. If you do come from, if you have the means, you can kind of, what people do is like they therapist shop. You can, you know, you're going to do private pay. I'm going to pay out of my pocket for the therapist. So I can go and sit with you and be like, I'm not really feeling it. I'm going to go and sit with you and see, I'm not really feeling it, you know, and
Like
then pick their
consultations?
therapist. Yeah, like consultations. You can also do that with insurance, but you're just, the providers who take your insurance is a much limited pool. Versus like if you're going to private pay, you can pick whoever, you know, is out there. The thing about community mental health centers is that it is much less of a choice, right? You get who you're assigned, and hopefully it works out. And also with community mental health centers, there's a lot of turnover, right? It's very difficult to keep therapists there for the long haul. So you may have to switch therapists, you know? So that's like kind of some of the drawbacks when you're not coming from means to get, you know, and stick with a therapist.
Do you feel that that messes up that community?
It definitely can.
Because just if some people don't have that you know, that help, then you know they go out and wild out.
Yeah.
Or do you feel that you know, a lot of times it should be the parents' job to be that, or the community to be that therapy?
I think it's, you know, I think at the end of the day though, the person who is going to get therapy needs to be invested. Because it's going to be really hard if like the parents are forcing the child, or if the community is saying like, you need to go get help, right? If they're not into it and they don't want to do it, what are they going to get out of it?
And sometimes parents, they come from their own trauma, right? And we don't really know what they've been through because a lot of times they don't talk about it.
Yeah.
And then their parents' parents. So it kind of ends up being something generational.
Yeah.
Right? And then sometimes it just takes you to say, you know what, I'm going to break the cycle and I'm going to seek help.
Yeah. And that's really brave.
It is.
So now I just want to, again, someone who's seeking this help, how do they even go about doing that?
So if you are seeking out help, like I said, you can go and look up New York City Well, and they can help with the provider. There's a lot.
NewYorkCityWell.com. Okay, NewYorkCityWell.com.
Like NYC Well.
NYC Well.
Okay, NYCWell.com. Okay.
Right. And or you can call like 311 if you're not sure where to start. There's like a lot of city initiatives to help at least try to connect you that first step. Or you can call if you do have insurance, you can call your insurance company and say like, this is what I'm looking for. Or you can just go into your, if you have a primary care doctor, they can give you a referral. There's like a lot of different avenues that you can take to find a provider.
You think that I could like be like I could practice like, but like off the grid? Like I'd be like, yo, listen, you need relationship advice, like holla at me?
If you want to.
It's not illegal or anything like that, right?
I mean, people give advice all the time.
Want me to give you advice? Give me a situation, I'll give you some advice.
God.
I don't have one right now.
You don't have a situation?
No.
Everything is straight?
Pretty much.
I don't know if I believe that one right there.
I mean,
the body language said it's true, but I still, but my intuition, my third eye, I ain't never tell you about the secret third eye. The third eye is like, nah.
I can ask you something.
Go ahead, I'm listening.
Okay, so but it's more professional.
Whatever you want to ask me. I'm fine with that. I'm an open book. I got thick skin.
Okay.
Pause. No, I'm just joking. That was very inappropriate.
So, you know, you're a person who's like in, like you're out there. You're a public person, right?
At times, yes.
At times, right? So I think I had some, you know, I was thinking about coming on the show and kind of putting myself more out there, right?
Here.
On here.
Coming to my apartment.
Yeah.
Yes.
And thinking about what that would mean, right? And I was worried about it. You know, I was going back and forth about what that would mean.
What would you be worried about?
I mean, I think there's always risk when you put yourself out there, you know.
Risk of
like what people might think, you know.
About
I also
you or
about
what
me.
you did?
Criticism, right?
Criticism, right? Also, like I think that my profession is like private. Like, what if one of my clients see me on the show, right? Like, what are they gonna think about it? Like, it's like a risk. I think I felt, right? So that's the dilemma.
So that's the dilemma with you.
Yeah.
So
in my professional development.
That was the question for me, or you want me to?
Because you're a person who's have experience with like being public, but then having your private life. So.
Oh, okay. So, with you, right? So let me pull on. I wish I had like a white cape or something like that.
You mean like a lab jacket?
The hood people, we put the hoodie on, right? No, I'm just playing, right?
Okay.
I think that sometimes you outweigh the good with the bad. So when I say that, meaning, I don't know how many clients you have, but let's say you had 2 clients. But being here, you could help 1,000 people. So sometimes in life, we have to sacrifice some to help more.
Okay.
You understand?
Yeah.
So in turn, if that client or whatever is upset or bothered by you being in the public, the greater good is you reaching out to other people that may have been scared and sitting here today and saying, you know, I didn't even know nycwell.com to go to, or even calling 311 or having insurance.
Yeah.
So I think that the greater good is that. And I think that maybe those 2, and I'm using 2 because it probably would be only 2, that I think that you seem intelligent enough to grab, if not both, at least one can come back and say, hey, listen, this is what it is, blah, blah, blah. And they will have sense enough to come back into your fold.
Okay. Very good advice.
Okay, son. Okay, son.
Look how you're elevating.
You got it.
Yo, well, I just told you. Listen, I'll be honest with you. So I did get my doctorate like 2 weeks ago.
See, I was fully supportive until that.
I'm the hood. Like I do. So I have a radio show too. So I give advice. So I'm kind of like a psychologist.
Yeah,
too.
but that's a different type of advice.
This is an A and B conversation.
No, this is a different type of advice. Oh, so if a guy flies you out, are you obligated to sleep with him? That's the type of advice that he gives. Very different from yours.
Okay.
Let's be clear.
Just the same advice. Somebody probably sat with you, was like, yo, this guy asked me to fly out, and should I sleep with him or not? You better tell that person, you damn right you better sleep with him. What do you mean no?
I wouldn't say that.
Why not?
Because that's not what therapy is. If you want to give advice, right? Like from your personal DJ self, this is what I think, right? But that's not always my job. My job is not to always be like, this is what I think about your life.
But if they ask you a question,
right?
What you going to say? I don't give you advice?
No, I would say, well, what do you think? What are the pros of sleeping with him? What are the cons of sleeping with him? What would that mean? Really process it. Make a decision.
And then they give you that. Then they say, well, what's your advice?
If you like it, I love it. That's what I tell my clients. I am team you. You decide to sleep with him, we'll process that. You decide you don't want to sleep with him, we'll process that.
Or her, because girls fly guys out.
Yeah.
I've been flown out a couple times.
Yeah, so
and I had to give up my manly body. Are you acting like, you know what I'm saying? Like, you know what I mean?
Just have to be supportive of the decision.
But I do give advice daily.
Okay.
And I think that 80% of the time my advice be very helpful.
Do you worry that you give wrong advice sometimes? Do you reflect on it and think like,
Well, my advice, and I would let anyone know, is throughout my experiences and through my mindset. So therefore, and also for entertainment.
Yes.
I will make sure, you know, it is 100% for entertainment.
Yes.
So my advice, if you heed to take my advice,
at your own
kudos.
risk.
At your own risk.
Okay.
But most of the time, my advice I do think be great. So if I had to use the subject that she said about flying out, if you didn't want to sleep with that person, then you shouldn't have flown out in the first place, or had that conversation prior to going. Hey, you know, I know normally this is what happens when you get flown out, but I'm not ready for that just yet. Are you okay with that? And if that person says yes, and still continues to, you know, let you go, which 50% of people still may do, because they be like, I'm still going to, you know, try or whatever, blah, blah, blah. But at least you had that padding of conversation prior.
Yeah, I like the support of communication. That's very important. And managing expectations, also very important.
I think that's 100% important. You know what I'm saying?
You made sense twice in 1 hour.
Let me tell you something.
I'm gonna give you the
I
credit.
am a psychologist.
Don't
right
get used
here.
to
I'm a
it.
hood psychologist.
No.
I don't understand you. I'm just this is what I do on the daily.
That's why you can never give him no credit though. Like he gets
because I'm
so
a hood
gassed.
psychologist. Like this is what I do. You know what I'm saying? So it's like, you know, I understand that. I understand, like, you know, situations. So I think that maybe that when you said people of color, I think that people of color should come to me. I'm a little bit cheaper, you know what I'm saying? But I take cash.
Okay.
Straight cash. All right? I no insurance, no nothing. Come holler at me, DM me.
Narcissist. Here we go.
That's narcissist.
It's all about you. It's all about you.
I got
and
thick
your
skin,
needs
don't worry
and
about
what
it.
you want, and it's all about. It's DJ Self's world. We're just living in it.
So how private is coming to a psychologist?
It's confidential.
So let's say if they told you something that could, like, yo, a word to my mother, when I see him, I'm smoking him, I'm kill him, da da da. Is that?
So the only time that we have to report something is if someone is in danger to self or others, or if there's suspected child abuse or something like that. Other than that,
So, well, they shouldn't tell you that.
Well, if they tell me, I want to go hurt this person, and I'm like, who's the person? And they tell me, I'm like, do you have a plan? Yes, I have a plan. I already know how I'm going to do it, right? That's a little bit more serious than someone be like, when, you know, like, I'm so mad at that person. And I'm like, well, do you really want to hurt them? Like, is it worth going to jail? Is it worth what might happen? And they're like, you know what? Not really. So it's not like if you blurt it out, there has a process that has to be taken, and I have to do a risk assessment. And then if I feel like after that risk assessment is still a pretty dangerous situation, then yes, I do have to do something about
But
it. Like
everything else
legally.
after that is fair game.
So,
Like, yo, I cheated on my wife. I can't believe this.
Yep, fair game. It's
I mean, I'm
confidential.
sorry. I cheated on my husband. I can't believe this.
Yep,
'Cause
fair
women
game.
do cheat more than men.
They cheat better than men, not more.
No, women cheat more than men.
Better than
Right.
men, not more.
Both. I agree. Me and you are right. Better and more.
Not more.
Yeah, they do. So again,
Lies.
well, my story is, you know, so cheating on your husband,
Or
right?
your spouse, just cheating on your spouse.
Spouse. Let's be grown-ups and use spouse.
Okay. That's fair game.
Confidential.
Well, you wouldn't say, hey, you can't do that. Like, don't do that. You just don't give no advice.
Well, I mean, definitely we're going to explore it and how they feel about it, but I'm not here to judge them either, because then they won't feel comfortable.
So they could come to you with all these personal things besides being hurtful to self and others.
I would rather that they come with the personal things. I want to know the parts that maybe you're afraid to talk about.
Do that help you in life too? Like, damn, I'm probably going through the same thing they going through.
Does it help me?
Yeah, like sometimes, because I hear stories about other people and like, damn.
Sometimes, I mean, I think when I hear other people, it makes me reflect on things that are going on in my life. I think that's normal, right? Like, oh, wow, like, you know what? I kind of been through something like that too. Maybe the advice I gave was pretty good. Maybe I should have listened to my own, right? Like when we talked about it and how the conclusion we came to, you know, like, okay. So, because talking things out, you kind of maybe have a different perspective afterwards.
Is it hard for you to diagnose people that's not from your background? So let's say like an Asian person or something like that.
Diagnose? No, I think we have a criteria, and if I get to know that person and kind of in the same way that I would get to know anyone, even if they're from my background or not, right? I want to know about their cultural traditions, where they grew up, and all of those things. But no, it doesn't.
Or maybe another country.
Another country, definitely.
Because I know different countries, they have different.
Yeah, I do, you know, pro bono asylum evaluations. So folks that are coming here and they need like an evaluation for the immigration court, I do those like pro bono. So
To make sure that they fit to come and live in the USA.
Well, not that they're fit, but just like kind of them being able to tell their story, and then kind of me assessing it and seeing like, you know, that they're okay.
Again, how important is it for a person to come to a psychiatrist?
I think it's important if they think it's important. Like I said, if someone's not motivated to do it and they feel like it's forced, it could be a little bit more difficult. Maybe after some sessions, you're like, you know, it's not bad. But I think, you know, you have to be motivated, you know, to come and talk about these things, work on yourself, reflect on yourself. That's hard stuff. So if you don't want to do it, it's going to be a little bit more difficult to get in there.
What's a form of motivation?
Maybe if you just feel like things aren't going right now, or if you do feel like you're having a little bit maybe more intense symptoms. Like everybody gets sad, right? Everybody gets worried. Everybody maybe gets a little bit anxious, right? But when you feel like it's really impacting me in a different way, I'm not sleeping, I'm not eating, I feel really sad, it's hard for me to go to work, then maybe, you know what, maybe I should talk to somebody. It's feeling like a little bit more than just I'm a little sad. Sometimes traumatic events, you go to therapy to manage grief, loss, transitions, right? Sometimes when people like get out of college and they start working, it's like, it's hard. I don't know how to do this, right? Or maybe when they move out of their parents' house or they lost someone, right? All of those are transitions. How do I live my life this way?
Do you feel that even moving out of your parents' house, do you feel like that's normal to still live with your parents at a older age? When I use the word older age, let's say 30 plus?
I can't say what's normal or not normal.
The reason why I say that, right, because throughout my travels, right, you know, I feel like a lot of people that live in this metro area of New York area, that's like common, but, you know, I go to other places and like 18, you know, they out.
Yeah.
Yeah, 21, they out. They out of here. You know, they got their own apartment, even a car.
Yeah.
You understand? Whereas here, you know, it's like the average age is like 30, 31. Do you feel that same way?
What, like, do I see that same trend?
Yes.
I don't know. I think I see a variety of people with different living situations. I do think that, like, overall, people are staying home longer than they would in the past. Yeah, here.
Okay. But why is that? Is that kind of like mental health? Like, yo, I don't want to leave the nest?
I don't know. I don't think so. There could be a component, but I think, like, it's just been really hard to get jobs, and, like, people go to college and they have all this debt, and then now it's like, where do I go next?
So
you know?
Drinking, you said?
I said inflation. Like when I moved out, rents was like $700.
You left at 30?
I left at 19.
Oh, at 19.
Yeah, I was 20 when I first got my first apartment.
Oh, so you was out of there.
Yes, son.
All right,
I was making moves, you know what I'm saying?
You had the car? Not the car yet.
No, in New York City it's different. It's harder to have a car and an apartment younger in New York City because the car insurance, just liability, is $500. Like, and then when you're younger, you're trying to, especially if you have your own apartment and you're younger, you're not making as much. Like, things are a little different in New York City. If you go in the South, I feel like they usually have, like, the apartment, the car, but things are cheaper. Yeah. You have to factor that in, too.
Yeah.
Okay.
And I think it's how comfortable you feel with it. Some people are, like, already itching to leave the house at 18, but some others are like,
I couldn't have women in my house, so when I had to leave. I was like, I need.
Yo, he's always motivated by women. I've never seen. That's why
Well,
you
I think a lot of men are. That's why they wear, like, jewelry, and they comb their hair and different things. And women, I think, sometimes they do the same thing. That's why they get
It's not for men.
fake tatas and the big,
Not all women.
BBLs or whatever they call that stuff.
We're going down a slippery slope. So how long have you been in your profession?
So this would be my 5th year out of school. So
Okay.
so total, it's been about 10 years that I've been working at this. 5 years in school and then 5 years out.
So I ask that because I feel like within the last 10 years, we talk about stigma. I feel like the narrative has changed when it comes to mental health. I feel like, people are a lot more accepting of it. Like I said, especially, we're in the hip hop industry.
Yeah.
So predominantly we've seen a
I'm
change.
in the food industry. I'm a restaurateur.
Okay.
So we're in the hip hop industry and we have
food
Okay.
tour.
We have seen an increase, again, in artists, that a lot of artists, which are mostly male, they're talking about mental health. They're urging other people to get help if they need help with mental health. So have you seen, in your profession, have you seen not an incline, but have you seen an increase?
Like who?
Yeah. You see Little Durk getting help, Boosie getting help, like...
Are you talking about when Little Durk had the thing with Alicia Keys in the beginning?
That song,
of his,
he just dropped the song Therapy Sessions. Yeah. Therapy Session. I think that's really dope because obviously that's something that's probably been going on in his
like
head.
Little Durk?
I mean, I like some of his songs, yeah.
Oh, okay.
Everyone loves Lil Durk. But also, like, even someone like Boosie, who is a figure who is a very masculine figure. That people always associate masculinity with, like, getting help.
Yeah.
But I feel like a lot of these artists are setting a new tone when it comes to mental health. So I wanted to know if you saw an increase in people looking for help.
I mean, I think, yes. I don't know if it's one, like, I think there's a lot of contributors to that. I think COVID was one of the big ones, too, in terms of people, like, I'm going to prioritize my mental health, my wellness overall, and kind of thinking about their own mortality and what makes them happy. And so I think there's a lot of things that can impact it, so it's super important that if hip hop is, in the space to kind of encourage it, that makes it even better,
Right.
But I think that there's always kind of been a space in hip hop for people to talk about their struggles, and what they've been through, and that is therapeutic in itself, you know. And so sometimes when people are a little bit hesitant, but they do listen to hip hop, I'm like, you know, this is kind of like another form of like you to express yourself, right? And we can like think about different songs. I ask people to bring in songs if they want to kind of express something that maybe.
I like the song "How About Some Hardcore." Yeah, we like it raw. It's M.O.P.
Okay. What about a more therapeutic?
That is a song. Be like, yo, I still write stuff to make my brother get up and dance front.
Get in touch with your emotions. Get in touch with your emotions. We're having a get in touch with your emotions.
That's How About Some Hardcore. Like, that's M.O.P. Mash Out Posse.
He's in denial, but hopefully after this conversation, he'll think about maybe getting some help himself. And
I do. But see, the thing is, right, I think that, so since I'm a psychologist myself, you understand what I'm saying? It's like we'll be like combating against each other.
No, we can be colleagues.
Yeah, you could be colleagues, but it's just like, you know, like I may say something and be like, that I already know the answer.
Okay.
Shit I'm talking about. That's shit I'm talking about.
What are you talking about?
It's just, you know everything, right?
No, I don't know everything. I know a lot.
I'm done with you for today.
All right, good. Leave my house. Thank you. Hello, right? Get out.
I'll leave when I'm ready. I don't do what people tell me to do.
You know what I'm saying? So, all right. So now I just want to be clear because a lot of times I just want to make it so people would know the steps again.
Yeah.
You know, now, you know, a person is going through something.
Yeah.
And it's to the point where they really need to talk to someone. They type in nycwells.com. You go to nycwells.com, it says...
They're just going to be able to take you through the steps, a number that you can call, or if you need to, you know, fill in some stuff to maybe find a provider, so that way you can get connected.
Is there a way that they be like, oh snap, I liked her, and can they like get in contact with you?
I do have like a business Instagram page. I'm also on Headway, which is a platform where you can find therapists as well.
Oh, that's kind of, I'm sorry, my head.
Yeah, I know. That's why I refrained from saying it before.
So you said headway.com.
There's Headway.
Grow up.
No, I'm just, hey yo, just keeping it real. You know?
You're just talking about having thick skin, and now this is what you choose to giggle and snicker about?
That is kind of like, hey yo, I'm just keeping it real.
There's Headway. There's BetterHelp. There's Alma. There's all these platforms that can help you if you put in your information, your location.
What about yours though?
Mine is through Headway, or you can contact me on Instagram in my business page.
And we'll tag.
Yeah, you can.
Well,
tag
you can. Yeah, but we'll tag you on the post.
Yeah, I mean it's Dr. Rodriguez NYC, but it's, you know, there could be a lot of those that come up. So.
Any underscores or anything, or just Dr. Rodriguez NYC?
I think it's underscore in the beginning.
Okay.
Yeah, but you can. I'll give it to you. You can tag.
Okay.
No, we put it just right there.
What?
Oh, you can like put it in the.
Yeah. Hello. Duh. Hello.
You're so smart. I would have never thought of that.
No. I think so. Now also that's the steps for getting help. So let's say somebody like me, right? That feels like they got what it takes to be a psychologist.
Right.
How do they go about doing it now? You got to go to grad school.
You have to go to get your undergrad.
Undergrad,
Yeah.
I mean, okay.
Yeah, and then you have to go.
Undergrad is.
Your 4-year degree and like bachelor's.
So you gotta go to school for 4 years.
4 years.
Don't make it sound like that.
No, that's kind of like.
So you really gotta go.
Yeah.
For 4 years, and then 2 years, and then another 2 years. Like.
Oh, so 4 years first.
4 years first, and then you go to doctoral school after that, which is another 4 years. My program.
But before you do that, you gotta write the essay.
You have to do the applications, right?
The application, then the essay.
Yeah, and some people apply to many different schools, so it could be many different applications that you have to fill out.
You just gotta freestyle, and whoever accepts you.
Yeah, you go for interviews. You know, it's a whole process to get into doctoral school. And then my program, so every program is a little bit different, but my program, it was 4 years of...
you had a special program?
No, it's just like the school I went to. So every
What was this school?
The school that I went to Furkhoff Graduate School.
Say it again?
Furkhoff.
So it was kind of like quicker?
No.
Okay, go ahead, I'm sorry.
No, the reason why I went to that school is because it's in the Bronx.
Understood.
Yeah. So that program is particularly, you do 4 years of academic work as well as what they call externships. So you're doing part-time work already in clinics. You get to choose where you do your work at. And then you do 1 year of an internship, which is like full-time work.
So all I'm calculating.
It's 5 years altogether.
Plus the 4.
Plus the 4.
So this is 9.
This is 9.
So there's 9 years before you can even try to figure something out.
Yeah, and then you have to take a test to get your license afterwards.
And this is not automatic cash.
No.
I don't know if I could do that. That's a long time. But I think that someone who's destined to do it, I think that they should do it.
Yeah,
and
definitely.
take that 9 years out, because the 9 years of your life that you learn, it could be decades of greatness that you could do for the world.
The 9 years are going to pass anyway. So if that's what you want to spend the time doing, go for it.
And there's no partying or nothing in between this, none of that.
I mean, you can live your life, whatever, is helpful to you.
Worrying about partying. Anyway, so what's been the most rewarding thing so far on your journey within your career?
I think the most rewarding part of my career is really getting to know people, knowing the good and the bad parts of them, that they're allowing me into their life that way. And I've seen progress. I've seen people who are really struggling and then they're doing really well. And I think that's rewarding. Another big part of what I do is training. So like other psychologists of color who are coming up and they're like, oh, I've never had a Latina supervisor before. That's also super rewarding.
What is the advantage of that? Having a Latina supervisor, like, do you do something different that someone else wouldn't do?
I mean, I think there could just be like, we can have conversations about culture more readily, right? About like, because when you think about therapy, you're thinking about how the patient is reacting to you, but how you're reacting to the patient, because all of that is important in the therapeutic alliance, right? And so where you come from and who you are as a person, that impacts it. Okay. And so when you have, just how if you have like a client and they want a therapist who kind of looks like them, kind of from the same place, also important with like supervisors and supervisees, They want someone who's like, okay, you can understand what I've been going through or what I'm going through.
Maybe you could train me.
So first you have to do all your schooling. Then you have to get an internship. It's a lot of work.
You see this here? This is the age. Maybe you should be a psychologist.
Maybe I should.
I think you'd be good.
Oh my God, is that a compliment?
Oh yeah, I think you'd be good.
Oh my God, thank you.
You'd be good.
I'll probably never get one again, so I'm gonna cherish this. Thank you.
Now I'm gonna turn the page. See, I said that, so 9 years she could be away and leave me alone for 9 years.
I'ma still live here. I'm just gonna be going to school.
You're not away.
I'm still gonna live here.
Yeah, but you in school for 9 years. It's like, yes.
Pretty preoccupied.
Yeah, you're occupied.
Sorry, I can multitask.
Oh, man. All right, so how can they get in contact with you again?
Through my Instagram.
Tell them your Instagram again.
My Instagram is Dr. Rodriguez NYC _ in the beginning. Also, you can look in Psychology Today, psychologytoday.com. That also has a list of providers. I'm on there as well. And my insurance management company is Headway. You can find me through there as well.
Okay. And NYCWells.com.
NYC Well, not Wells.
NYCwell.com.
Yep. You can just Google it if you want, and then all the information will come up.
Or 311.
You can call 311 as an entry point.
Okay.
Yeah.
But primarily NYCwell.com.
Yep. Or if you go to any of, like if you have a PCP, a provider, a school, anyone that can kind of help you with the referral process.
So anyone that's out there that got any issues, anything like that, you go to nycwell.com. If you ain't got no bread, holla at me. I'll give you some entertainment advice. I'll try to do my best. That's not good?
Yeah, it's fine.
Like you just said, I gave good advice with the flying out. Did you say that?
Yeah, people can give good advice. Doesn't mean they're a trained professional.
No, I'm not trained. I'm not trained.
Simmer down now.
Yeah, this is entertainment purposes only.
Entertainment purposes.
You know what I'm saying? But I'm pretty good not trained. Okay. I'm like A+ not trained. So that's kind of like
you're using your life experience. That's your training.
Yes.
Okay.
That's valid.
That's
somewhat.
valid. Yeah.
You know what I'm saying? And I've been through a lot of things. I've seen a lot of things.
Yeah.
You know what I'm saying? Would you need advice for anything?
Hold on, that's my little violin for you.
I told you, crazy women, they do hand gestures
shut up!
and things like that. So if you ever learn something now, if you have a patient and they start, especially with the head like this way,
then look out.
Yeah, just be like, listen, sweetheart, I know,
Okay.
chill out for a little bit, take a seat, you know what I'm saying? Sleep take a nap.
If I'm crazy, you crazier because you be letting me in. I mean, I barge in, but nonetheless, you don't.
You see the eyes and all. You see the eye rolling, the head swinging around. I'm just letting you see. That's how you.
You be studying my movements,
loca, right? That's how you say it in Spanish.
No, you can't say that. We're talking about a serious subject.
No, I'm talking about you. You know.
Anyway, you crazier for letting me in the door. So.
Well, thank you.
About you.
Thank you. Thank you so much.
Thank you.
You got through it.
Yep.
All right.